Hi, everyone. My name is Jeremy Jacobs, and I am a rising junior at Duke studying English and public policy. So today I'm going to give you all an introduction to a specific project that I've been working on. So this summer, I've interned with the Payment and Delivery Reform team under Robert Saunders. Today, for the sake of time, I'm going to focus in on a single project related to the changes to maternity care that we've seen during COVID-19. But I also want to quickly acknowledge the other primary projects I'm working on, including one examining how healthcare stakeholders are eliminating wasteful services um, in, what's it called? Why am I sharing the wrong screen? Let's see. Sorry. Um, okay. So,
No, we're seeing your slides.
sorry. Including
That's
one
good.
how healthcare stakeholders are eliminating wasteful services in the healthcare system, as well as a rapid evidence review looking into what Margolis is doing to understand and address disparities in social determinants of health. And I also want to thank everyone on the Payment and Delivery Reform team for getting me up to speed and including me in their work over the last few months. Now to zoom in on the maternity care project, in many areas of the healthcare industry, COVID-19 has led to widespread changes in utilization. And in response, payers and providers have adjusted the delivery and reimbursement of healthcare services. This particular project emerged out of conversations with the North Carolina State Medicaid Agency and their interest in what other states are doing related to maternity care during the pandemic. And so we've examined Medicaid and commercial payer policies, and particularly those that aim to manage risk for pregnant women, integrate social determinants of health, prevent growth of health disparities, and mitigate provider financial distress. We began this project by doing an environmental scan to determine what payer policies had been published online. We examined 9 states, including New York, California, Texas, and more, digging through the press releases and web pages of state Medicaid and managed care organizations. In the second stage of the project, we developed an interview guide and began reaching out to a variety of stakeholders relevant to maternity care. And currently, we are conducting these interviews with providers, NGOs, professional maternity care organizations, Medicaid payers, and other stakeholders. As we begin to wrap up our interviews, we are quickly moving into the final stage of the project, where we hope to develop and publish an issue brief in the coming weeks. While a lot of the analysis has yet to be completed, there are some clear themes that have emerged from the environmental scan and interviews. By and far away, the biggest changes in maternity care has been the shift to telehealth and virtual care. In the last few months, utilization of virtual care has exploded across the healthcare industry, and in response, payers have increased reimbursement of telehealth and audio-only care to parity with in-person visits in many cases. I'll temper this finding by saying that this change isn't specific to maternity care. It's part of the broader shift of many healthcare services to virtual care right now. And in general, most actions by payers in response to COVID have not been specific to maternity care. But regardless, the movement to care delivered at home still has profound implications for pregnant women. Typically, maternity care requires many in-person visits to monitor the health of a mother and her unborn child. But with the proper equipment, women can monitor many of these vitals at home, reducing the need for in-person visits. During the pandemic, North Carolina Medicaid, for example, has begun the reimbursement of blood pressure cuffs and scales, and combined with telehealth visits, women have little need to visit their OB physician as frequently as before. And this change, one initially designed to reduce exposure to COVID, is one that may persist even after the pandemic. But not all of these changes are as fruitful as the telehealth one. During the pandemic, some providers have noted an increase of non-evidence-based procedures, such as an uptick in unnecessary C-sections, for example. And state budgetary issues have also delayed the implementation of measures that expand postpartum coverage and push value-based payment models in maternity care. And some hospitals have also limited the presence of birthing partners and doulas during childbirth. And there are also persistent questions of quality and access. While much of the literature supports that video-based telehealth offers similar quality to in-person visits, less is known about the effectiveness of audio-only care. And while telehealth, generally speaking, eliminates the need for transportation, there are some concerns that telehealth may contribute to other disparities, as virtual care often requires access to a camera, smartphones, and broadband. And while there is some evidence that COVID has led to a reduction of some low-value care, decreasing the length of long hospital stays, postpartum, for example, it may have also led to a reduction of high-value care services, such as immunizations in pregnant women. But right now, it may be too early to get at some of these questions, and it is unknown how these changes might affect maternity care outcomes. So next steps. Number one, I have extended my internship into August, and I plan to do some additional work over the next few weeks. By the end of the next week, we plan to finish our remaining interviews and spend some more time drawing out common themes that have come up again and again. And we've already begun a rough outline of what the issue brief will look like, and we aim to have an initial draft by the end of the first or second week of August. And so that is the basic overview of where my project is at, and I look forward to any questions y'all might have. Thank you for listening.
Great, thank you. So any questions for Jeremy? Well, I have a quick question. So you were saying that you were extending through August, and so what specifically are you looking to kind of take on in this next few weeks?
So I think most of the work that I think I'll be doing is direct drafting of the issue brief, along with Yolande and Rebecca, as we, have done a lot of work to figure out what are the most common things that have been touched on, and also, what areas might need to be addressed. So as we go through that and do some iterative work on the drafts, I think that's the major next steps that I'll be working on.